If you want to learn about your heart, you don't want to bypass this morning's Carolina People. Coming up next. Good morning. Welcome to Carolina People. This morning we're at the Real Estate Career Institute on the corner of Highway 17 Bypass and Wachesaw Road in Murrells Inlet. We're focused on heart disease and stroke, and we're visiting with a cardiovascular surgeon from the McLeod Heart and Vascular Institute in Florence. Good morning, Dr. Jamie Holland.
Good morning, Greg.
Thanks so much for coming in and bringing some great props here this morning. It's nice to have a good setup early on a Tuesday.
Thank you. Thank you. It's great to be here.
Have you been down to Murrells Inlet before?
I have visited Murrells Inlet. Beautiful. I'm glad to be here once again. Rather be here under recreational purposes, though.
That's right. That's right. It is great to get down in the creek, and of course this Real Estate Career Institute and their amazing facility here. They're doing a lot.
Yes.
Doing a lot. Much like another institute, the Heart and Vascular Institute. You guys have been jamming up there in the PD.
Yes, we're excited about the recent initiatives that are underway, and a lot of prospects for growth and new technologies in the near future.
Absolutely. Are you originally from the PD, Dr. Holland?
No, I'm not. I'm originally from Indianapolis, Indiana.
Okay. Yeah, a little ways away, right? What brought you to the Florence area?
There's a lot really happening that's exciting in South Carolina in general, but also in Florence. I think Florence itself is a very dynamic medical community that has brought a lot to the forefront in medicine, not just catch-up medicine, but is actually leading the way in many areas of medicine.
Really?
Specifically with the heart, which is obviously my interest.
Right.
Electrophysiology, the treatment of heart rhythms by either catheter-based techniques, medications, or even surgical techniques are some of the newer areas that have been brought to Florence and leading the country there. Their heart surgery program is state-of-the-art, specializing in heart valves and revascularization of coronary arteries. There are just many exciting opportunities that brought me here. Also, it's a very nice community.
It is, absolutely. The PD area, and of course McLeod with its deep roots there, and of course you've got there's another great institution, Carolina's hospital system, and I'm sure a lot happening there. But McLeod is a community hospital doing so much to make a difference in that area, and they're big supportive groups like the American Heart Association and others in the PD.
Yes.
We
work strongly with the American Heart Association to make certain that the community is aware of what is happening in the treatment of heart disease, making certain that all members of the community are informed.
Right.
There is a tendency for focuses to be directed towards educational groups.
Right.
Seminars are directed many times at the professional groups, where our message is to the entire population. Make certain that every member of the population has the same information and the same access to heart care.
And so oftentimes folks think of heart disease and stroke as an older person's issue, which of course you found in your work over the years that it's clearly not just that.
Right. Acquired heart disease can affect anyone from in their early 20s all the way up to 90s.
Right.
I've recently had a patient here, and the short time I've been here, my oldest patient here was 89. Interesting story, if I can digress a little bit. I hope this doesn't go off the beach.
Sure.
But I met her probably about 2 months ago. She had a younger sister who was 83, who had had a similar heart problem, had received consultation, and left with the conclusion that she was too old to have a heart operation. This had occurred within the same 6-month interval. This particular patient came in with a problem and had already made up her mind she was not going to have an intervention if it involved heart surgery.
Right.
Well, when confronted with the issue, it's either this or the alternative is not so pleasant. It left the family in a great deal of distress and disagreement. So half of the family thought she was too old, should not have the operation. The other half thought, okay, well maybe, but it caused a lot of controversy. So I gave her the information, left the room, and came back the following day. She was about 4'9", about this tall. and I'm 5'11".
Right.
She's standing at the foot of the bed. All the family's left the room. She looked up at me. She said, "Dr. Holland, this is my life. It's my decision. I want that heart operation."
Is that right? This 89-year-old.
89-year-old. Visitor in my office yesterday, decked out to the nines. She had makeup on, earrings, necklace, beautiful jewelry. Couldn't tell she had a heart operation.
Wow.
She reached up and gave me a great big hug and said, "I'm glad that we went through this." So it serves to illustrate that we're really not too old to have interventions with current technology.
Oh, yeah.
My youngest patient is actually 23.
Is that right?
For coronary disease.
Right.
For valvular disease, my youngest patient is 16.
I was about to say, we had 2 guests on in February who I think each called themselves blue babies, or something that had occurred at birth.
Right.
And it obviously impacted them at a very early age. So
Exactly.
something they started thinking about. One, a young lady who's matriculating to Clemson in the fall, who's had 3 or 4 open heart surgeries. Beautiful, pageant young lady. It was fascinating hearing her talk about flying to Dallas, Texas, or somewhere. There's a great location out there where she's had a lot of open heart surgeries.
Right. Congenital heart disease means from birth we're actually able to diagnose these babies now in utero.
Is that right?
And so these operations are planned not because they're blue. We're planned because we know they're going to be blue.
Right.
And so we can time those operations at an appropriate interval to achieve the best anatomic and physiologic correction for that individual. And what took maybe 3, 4, or 5 operations historically, we can now achieve with 1 or 2. Now, I'm not a congenital heart surgeon,
right,
but there are some phenomenal accomplishments being done around the country there too.
Oh yeah, I'm so glad you brought some great pieces here. We want to talk some about the heart, but for viewers who may need to get off to work now or get out of the house, is there a good phone number for someone to call to ask some good heart questions, or even a good website for someone to visit? Is it the McLeodHealth.org site?
McLeodHealth.org is the internet access,
right,
and there is a home page which will direct viewers and patients to the appropriate site.
Okay.
For many of us who are older than the internet crowd in the 10s, 20s, 30s,
sure, I
like to use the telephone.
Yes.
And McLeod's switchboard telephone number is 777-2000.
Very easy to remember. 843-777-2000. Very easy. Okay.
And within the next 3 months, we will have a toll-free number.
Great.
A 1-800 number. I don't know that number at this time, but it will be widely published and accessible. That will be an opportunity for patients or physicians to contact a surgeon or cardiologist directly.
Absolutely.
At any time, day or night.
And I'm so glad you point that out, because so oftentimes we'll get guests in who want to promote their website, and virtually their website exclusively, but a heck of a lot of viewers who tuning in are just not going online. They're particularly not going online at 7:15.
Right.
And if you've brought up an interesting point, they want to pick up the phone right now and call somebody, particularly when you're talking about a 24-hour helpline for good cardiovascular or heart disease and stroke questions. And a lot of our viewers in the PD and down here in southeastern North Carolina are thinking about heart disease and stroke because it's impacting them, their children, their parents, their lives.
Well, to support that, Greg, I think that it's important for people to understand that, number one, we not only have developed the internet, which is invading or supporting all of our lives, however you want to view that.
Right.
Along with that has come the cell phone. And as people drive to work, the cell phone is there, and many people can just pick up that telephone and dial directly. I know we're not supposed to do that as well.
Oh yeah, no, sure.
But it's also become a part of our life. But more importantly to me is I've realized over the last 10 years of my profession that the average age of my patient has increased.
Right.
In the 1990s, mid-1990s, the average patient undergoing a heart operation was somewhere in the neighborhood of about 58 to 62.
Okay.
Over the last 2 years, the average age of my patient is 78.
Is that right?
Yes.
Wow.
Yes. So when I think of my grandfather and grandmother when they were 78,
sure,
I can't imagine them logging on to a website.
Yeah.
But it's also difficult to navigate that, and the telephone is the preferred source for that demographic population.
Why do you think that age has gotten so much later? It sounds like groups, I'm so glad you mentioned your tremendous involvement with the American Heart Association. Groups like that are getting the word out to try to get folks more heart healthy and heart conscious may have seeped in as long back as 10, 15, 20 years ago to the present. Why do you think that the age would have creeped back to 78 as your average? That's fascinating.
Well, I think that's multifactorial. Part of it is, a great part of it is, I think people are very health conscious now. Mm-hmm. And particularly in this region, we have people who are out on the beach, people who are involved in exercise programs.
Right.
They're watching their diet. They're listening to their doctor's advice for the most part. Mm-hmm. People fall off the wagon every now and then, but it's a much more health conscious community.
Right.
And that's translating into increased years. And we want to see that continue.
Oh, yeah.
The other aspect I think that's equally important is that as a profession, we have evolved in our techniques and application of what we know of heart disease, and we're able to take on an older patient, which may not have been considered appropriate 10 years ago,
right,
with outstanding results. Think about cardiac surgery as a baby as far as technology is concerned. We did not really perform cardiac surgery to any degree of complexity until the mid to late 1970s. Mm-hmm. And the first operation that we performed on a regular basis was coronary bypass.
Right.
Think about that. That's just 30 years ago. That's not very long for any professions, particularly a health profession.
Oh, yeah.
As we have developed a greater understanding of the heart, and how our interventions affect other areas of the heart, we're able to eliminate many of the problems and complications that our forefathers in cardiac surgery couldn't even. And so we're able to offer much more than we did in the past. Even over the last half a decade, 5 years ago, we couldn't do the things that we're doing today.
Is that right? That dramatic?
It's developing the same way computer chips are. It's the growth is explosive.
That is wonderful. The funds are being found to do the research, to have researchers out there making a difference, whether it's great community hospitals finding the dollars to invest in research, or groups like the American Heart Association, or so many different ways to fund dollars into research so that you'll continue to see great things. Let's talk about the heart for viewers now on a Tuesday morning. It's about 7:15 who may want to know a little more about the heart. How does the heart work? How does it work exactly? You've got a great sample here. It looks like this is pretty well, maybe not to scale, but a good shot here.
This is, and looking at it from the camera, as a heart surgeon, that angle is what I see every day in the operating room. Now, let me preface by stating before I get into an explanation, most heart surgeries carry a risk that is less than a gallbladder operation. So when I encounter a patient, most of them are initially struck that they're not going to make it through the next day. But putting into terms that if I were a general surgeon coming in to say, you've got a bad gallbladder, I need to take that out, when can we do it, Doc?
Yeah, hurry up.
When you put it in that perspective, the risk is the same. Most heart operations can be done with less risk than a gallbladder operation. So in answer to your question, though, the heart is actually a very simple structure. It's a very resilient structure. It's simply a pump. It has two pumping chambers, and we're really going to ignore one because there's not much in today's society that affects the right side of the heart. So we're going to pretend it does not exist because it usually isn't relevant to the United States. And we're going to focus entirely on the left-sided pumping station. So the pump will have an inflow and it will have an outflow. Blood comes into the heart squeezes, blood goes out. It's that simple. So there's a pump that does this 60 to 80 times a minute with an inflow and an outflow. Like all pumps, it needs an energy supply, and it gets its energy supply by way of coronary arteries. Now, we're turning this so that we're viewing only the left-sided pumping station. I'll open the heart to show the inside of the pumping station. This is the muscular portion, and if you were to see this, this would look much like what any muscle would look like that we would encounter in the grocery store. A piece of nice steak. It's nice and thick, but the coronary arteries will actually sit on top and run down the front of the heart and pierce fuel lines within the musculature itself. Blockages in these coronary arteries are the most common disease affecting adults today. As a matter of fact, particularly any adult, we have the tendency to think that this is just men. The leading killer of women in the United States is still heart disease.
By far, yes. By
Leading
far,
killer.
sure.
So, and that's blockages.
I'm glad you mentioned that.
So we have fuel lines, coronary arteries. We have valves, which open and close and allow blood to enter at the appropriate time and allow blood to exit at the appropriate time. This is an example of a mitral valve, which is actually
a mitral valve.
A mitral valve. It's shaped almost like a bishop's mitre. That's why it's called the mitral valve. But it is also an important structure because it actually forms the skeleton of the heart. We don't think of the heart as having structural elements like bones, but in fact the mitral valve itself is a structural element, in that if we look at this on the internal portion, we see the valve here, and it attaches to the muscle here.
Wow.
But the top of the valve is actually a circumferential ring that the entire musculature is suspended from. So the heart has structural components, muscular components, valvular components, moving components, and a fuel supply.
Fascinating. And the fuel supply is?
It's blood,
right?
But blood primarily because of the components it carries, oxygen and sugar. Remember, 60%, 65% of blood is just simply water.
Right.
The cellular component is 35 to 40%.
That is fantastic. Well, I'm sure glad. And complications on the mitral valve side, are they very common, or is it, maybe you just said that, and forgive me, I was so mesmerized looking in there, watching your hands move in there. The complications, are mitral valves replaced on a regular basis? Is that something that you do, or is that something that, and maybe real quick, the difference between a cardiologist and a cardiovascular surgeon, are there different procedures that they would perform?
Yes. Cardiologists, historically, let's say prior to 10 years ago, were primarily involved in the detection of heart disease and the medical treatment of heart disease. Over the last decade or so, they have been involved, specialist cardiologists, interventionists we call them, have been involved in opening blockages in coronary arteries by way of percutaneous techniques, a catheter through the groin.
Right.
And they've done a nice job there that has prevented or delayed, depending on the argument which side you take, delayed many patients going on to have an operation and maybe prevent many patients from ultimately having a heart operation. Surgeons have always been involved in the treatment or the anatomic correction of structural elements of the heart. We bypass the blockages. And just to illustrate here, a bypass is simply attaching a piece of vein or an artery to the aorta, the outflow tract. So, in essence, blood would come out of the heart. As the heart pumps, blood would come out, come through the aorta here, travel down this bypass, and we can attach that to any area on the heart we choose to beyond the blockage. That is simply a coronary bypass.
That's interesting.
We suture this end to the aorta and this end here. This bypass requires approximately 10 minutes.
Is that right?
So,
and those are relatively permanent? I mean, does that, or do those need to be done on a...
That's a very good question. Historically, back in the 70s, 80s, and early 90s, we thought that a vein graft, a piece of vein that's removed from the leg and placed on the heart, had a lifespan of about 10 years. We're now finding out that that isn't entirely true. And this is one of the areas that technique and technology have put aside. When we initially started this operation, we would take technicians or assistants and ask them to harvest the vein. they weren't highly trained, they weren't sensitive to what the vein actually was, and so there was a lot of damage being done to the vein as we removed it. So many of these veins were actually closed because of surgical technique. Now we know, by way of more sophisticated vein harvest techniques, that these veins will hold up, but they also have a different patency rate or lifelong span based upon which vessel they're bypassed to. So many of these will hold up for life, but we will also use arteries to bypass hearts or blockages. And so arteries, so there's an artery that comes from the undersurface of this particular branch, which goes to the arm, runs down behind the breastbone. We can detach this from the breastbone, swing it over, and attach it to the same place. That artery will never close. So it's a lifelong operation now. So in answer to your question, most coronary bypass operations will last a lifetime. Only a small percentage will require a re-intervention.
That is fascinating, Dr. Holland. That is very interesting. So many other aspects there. I'm sure there's lots of frequently asked questions. I assume probably a lot of people don't ask, how does the heart work? Because they want to get to the nitty-gritty. But thanks for sharing that. I'm sorry we only have a few minutes. I've got so many more questions that I'd like to ask. And of course, you just highlighted the potential links, how that would impact their life and how much longer that could potentially open the doors for them. But was there any influence for you at an early age? And that's really something. Is this an aspect that you've been thinking about for a long time, getting into cardiovascular surgery or being even in cardiac work at all?
That's a very good question, and I'm going to give you an answer that will surprise you. And the answer is no. I believe that life is a river, and the currents and the eddies will direct us to our ultimate journey. And my father was a construction worker, and as a boy I would travel with him. He was a repairman. He was a furnace repairman.
Right.
And throughout college I became interested in physiology, the human body. And then in medical school I discovered surgery and found that much of surgery is machinery. Much of our body functions like a machine. Once we understand how it works, we can actually apply techniques to fix it. And so that's what ultimately led me to heart surgery.
That's fascinating. That is very interesting. Well, that doesn't surprise me at some level because, as you say, so oftentimes folks will end up, I mean, think about what's happening in children in college, kids in college, 18 to 22. So many diversions for them and what they may have thought of going into college versus what they get, what they're doing when they get out. So things change dramatically.
I think so. And for the young people who might be watching today, my son is in college, and I have not directed him. I said, go. It will reveal itself. Take your time. Your interests will reveal themselves, and the most important thing is do what makes you happy.
Good for you.
Certainly being a heart surgeon has brought a great deal of satisfaction.
Right. Heart and Vascular Institute there at McLeod. Folks travel quite a long distance to get to y'all's institute there.
Yes, yes. I've had people travel 4 hours to see me. And again, patients with complex heart problems really don't want to travel hours away to have a procedure, particularly if they can be close to home and have the support of their families. So we offer this to the community, but certainly the field of expertise that we have goes into the valve areas, people who have reoperative requirements, complex heart problems. Those people will need to travel, but we like to make McLeod seem as much like home and have the home environment as we can. That's
great. I can tell that just sitting here with you. If folks are making that trip, you know, or for folks who aren't making the trip who want to learn more about the Institute, and I know you've just been there 4 or 5 months, does the Institute offer workshops or seminars to more better educate the public?
Yes, we do. Many of these are not convenient to people. We offer many during Heart Month. We will also offer some in the fall. But with this type of disease and the gravity that's assigned to heart difficulties, I like to have a personal access to patients. So I'm happy to discuss problems, suggestions with anyone at any time, as are my colleagues at McLeod, the cardiologists and the other heart surgeons. So those numbers are available, their names are available, and will be easily accessible with that 1-800 number.
That'll launch in the next 3 months. And of course, the 843-777-2000, or going online to McLeodHealth.org. Folks can find out more about the Institute, the Heart and Valve Vascular Institute there at McLeod, by spending a little time on the internet or picking up the telephone. And, you know, that aspect of things changing and obviously time changing, you ending up in that position. What if you weren't a cardiovascular surgeon? What do you think you'd be doing? Do you think you'd be following your dad, working on furnaces?
I think I would. I like the mechanical aspect of solving problems. We have to have a basic understanding of any system that we have.
Right.
But once we have that, the fuel supply, the pump, the valves, it's a mechanical component. The aspect that construction and mechanics doesn't have that being a heart surgeon does is the human element. There is nothing more important to me than walking out of that room and shaking the wife's hand, and I say the wife, the men don't have the emotion, but the wives are always in the waiting room, a lot of anxiety, many of them have tears in their eyes, but when I walk out and say things are going to be fine, a universal response is just to reach up and give me a hug. That means so much to the physician, and I'm not certain that our society today actually appreciates how much that hug actually means.
Those are great words. Thanks so much for being with us this morning, Dr. Holland.
Thank you, Greg. Appreciate it.
Absolutely. Stay tuned to more Carolina People with Dr. Jamie Holland coming up next. You heard him talk about the hugs that he loves to receive from the spouse of a patient, but it's the hugs that he talked about off camera that he really wanted to focus on, the hugs that he wanted to give the nurses in the operating room, the nurses in the intensive care unit, and the nurses in the wards, the folks that make such a difference in patients' lives, along with the cardiovascular surgeons and the cardiothoracic surgeons and the radiologists and the cardiologists, everyone working together to make a difference right there at McLeod Health. Give them a call at 843-777-2000 or go online to McLeodHealth.org.